Thanks for joining us, Frank.
That's all right, Andrew.
Frank, can you just explain what your role was in a prior life?
Well, I'm 41 years ex-Victoria Police. Ended up here at Benalla as the inspector in charge of the local police area.
Okay, so we'll cut right to the chase. I've got you in here today to talk about sleep apnea, and you don't mind me saying that you're a sleep apnea sufferer yourself?
Yep.
And I suppose we'll talk to you about your own personal experience with sleep apnea, and also what you've seen, through the police force, traffic accidents and the like, whether you think there may be a link between the two.
Yeah, well, I've always, as a younger person, had snoring as a problem. It got to a point where now my ex-wife moved out of the bedroom because of the snoring, and I think I've told you the story. As president of the police ski club, I had the ability to keep the whole ski club awake with my snoring. So in about 1992, I as a result of sort of nodding off behind the wheel of a car, I thought time I did something about it, and was diagnosed with sleep apnea.
Right.
And the telling part of that assessment was I stopped breathing for a minute and a half, which is a fair time. And anyway, from that I was given the CPAP machine, and I haven't looked back. It basically changed my whole ability to get on with life and not feel tired all the time, and certainly I've had no more of those nasty experiences of falling asleep at the wheel of a car.
You talk about that falling asleep at the wheel of the car. Let's go back to you being the police officer, and I'd imagine being in the country would have been first at a few accident scenes.
Oh yes, I mean I think it is a very undiagnosed area, in that there are a lot of people out there who suffer sleep apnea and they just don't know they've got it. And what's even worse is I have a brother-in-law who knows he's got it but won't do anything about it.
We see that quite frequently. We'll get referrals through from doctors for patients to get screened, and they won't do anything about it, and they'll come back in 18 months' time, and the thing that they come back with is, I wish I got onto this sooner.
Yeah. I'm not picking on truckies, but even people driving. The Hume Highway is not a very friendly environment to a person who has sleep apnea, because there's just long stretches of straight road. You add warmth on a hot day, or in winter when you put your car heaters on, driving for long periods and in a straight line where you don't have to worry, you've got the cruise control on, and it is very, very easy to nod off to sleep. And not everyone who nods off to sleep suffers sleep apnea, but I personally think there is an underlying problem there that people aren't aware of it, or if they are aware of it, they're just not doing anything about it.
So you talk about sleep apnea and how you were diagnosed back in, what was it, 93?
93, yes.
Yeah, so where did you get your sleep study done?
I had it done at the Epworth Hospital. Yep.
And if back then, if you were given the opportunity to get the sleep study done at home, do you think that would have been an easier process for you, or?
I think it would be a far better way of doing it, because going into a hospital in a strange bed and that, you tend, I know I've been in hospital a fair number of times, and it's not the same as sleeping at home. So, and I know the night I was diagnosed, I tossed around and that anyway, because it wasn't my bed. Where if it was done at home, we're in a bed that you're used to and get a good night, or as far as you know, at that point of time, you get a reasonable night's sleep, you're certainly going to get a far more accurate appraisal of your condition.
Yeah. And the other thing I want to talk to you about is CPAP, how you say you never look back. Let's go right back to the start, when you first started using CPAP.
Yep.
Did it take you some time to get used to using the device, or were you able to pick it up straight away? Or
Well, obviously 93, it's over 20 years ago now, and you were given this nasal mask, and I must say I was a bit apprehensive about putting a mask over my nose and having the comfortability of sleeping, but yeah, occasionally I had issues, particularly on a hot night where you sweated a little bit, but the new devices that basically plug into your nose, I've you know, the generational change or the refinement of the way that it's administered has been basically a godsend. The wearing the mask does not worry me, and I was given that warning back in '93 that where I was at an age where it would be easier to put up with the having a mask over your face of a night. And they said the older you get, the more resistant you are to it. So I mean, but as I say, things have improved so much. You know, the nasal plug I'm basically using, or face mask I should rather than call it a plug.
yeah, the nasal pillow, I think.
Is very comfortable, and it really doesn't cause me any great dramas.
Okay, so back to the sort of symptom relief you've experienced from treating your sleep apnea. You know, you talk about not nodding off behind the wheel. You know, pretty major thing.
Yep.
Are there any other things that you've noticed, you know, as a result of treating your sleep apnea, where you've felt differently, better, worse?
As I said, I haven't looked back. I've always been a sportsman, and I thought I was overtraining at some points, and it was really sleep apnea. But now I wake up of a morning, I feel a lot more refreshed. I basically get up wanting to do things rather than thinking, oh geez, that was a terrible night's sleep, but just, you know, what did I do? And one of the things that did amaze me was I used to think I was a person who never dreamed, and because I'd wake up in the morning and not have any memories of a dream, and it got explained to me when I was first diagnosed that to dream, it's a good state of mind as far as getting a good night's sleep.
Yeah, rapid eye movements.
Yeah. And the non-dreaming syndrome was basically a result of the fact I had sleep apnea. And I sleep now and dream, you know. I don't think they're way out dreams, you know, they're not nightmares, but you know, it gives me that good night's sleep, and you just wake up more refreshed in the morning, and you're not wandering through the day yawning and having those issues of, oh geez, I need a nana nap. Well, yeah, occasionally you get tired, and particularly if you have a late night or something, but you wake up and you generally wake up of a morning and just feel you're able to face the day.
And you spoke earlier about a previous relationship, which we won't delve into too much, Frank, but you know, I know that you've since moved on and you're wearing the machine. How does your partner feel about you using the machine? And you know, I'm assuming that she's happier that you're not snoring.
Yeah, look, the sleep apnea machine stopped that terrible snoring. I mean, I've got a loud voice. I mean, I was an old drill instructor at the police academy, so I do have a loud voice, but the snoring was terrible. And I know I've been camping with my wife where you can't use the CPAP machine, but we now try to live our lives so that wherever we go we can use it, and and my wife's more than happy for me to use it, and because it gives her a good night's sleep.
Yeah, that's good. You just open up an opportunity for me to sell you some products where you can use it while you can, but we'll talk about it in private in another time. So Frank, in our previous discussions, we've talked about you having diabetes. Has CPAP helped manage that? I know there's a lot of literature out there, and I'm still getting my head around, that. I just want to know, whether it is helping to treat these comorbidities.
The thing I can say about diabetes, it is complicated, and before I was diagnosed, sometimes it was very easy to think when you'd start to get tired and all that sort of stuff that it was the diabetes having a hypo. But you don't have that confusion anymore. You know that if you start to feel tired or start yawning and starting to feel funny, it's got nothing to do with sleep apnea. It's got to do with the diabetes. So you can be more specific in doing self-diagnosis.
Do you measure your blood sugars on a pretty regular basis?
Yeah, I'm measuring myself at least 4 or 5 times a day. And
I know it's a long time ago now, but were you diabetic before you had CPAP? Or
I've been a diabetic. I was diagnosed with diabetes 1 year into being in the Victoria Police, and if I'd left my joining date 18 months, I would have never got into the police force. So I went through a lot of my police career, nearly half my police career, the whole police career suffering diabetes, but the first 20 years working night shifts and that, I found once again getting that CPAP machine, even using it during the day, I got a better day's sleep, and there's a lot of studies out there that say that people who sleep during the day do not get as good a night's or a good sleep as if they're doing it at night time. So there's a lot of those little issues that.
And have you noticed a difference with the sugar levels prior and post CPAP? Did you notice any change there? And maybe not. I don't know. Yes,
I mean, look, it's the whole administrating of the diabetes. It's if you're tired, you're getting these false signals, and then but the overall control I've found since I've gone onto the CPAP machine, I don't have. I mean, occasionally I get the extremes, but I don't have as many of the extremes.
A bit of a loaded question here, and it's going to be hard to bag me in front of my face. But, have you found that since we've opened up here that you have been able to have your sleep apnea controlled in a manner that's satisfactory, that stops you having to travel down to the city to get the treatment?
I get other treatment for diabetes related issues, and the fact that they have these health services like the service you provide takes away a lot of headaches about having to drive to Melbourne and spend a lot of time in Melbourne, and all I can say is that having someone local who knows what it's all about and can provide the service and the backup service when things go wrong, because I know that I remember about 12 months ago coming to see you when I thought my machine wasn't working. You pulled the little computer chip out and says, "You're right, there's something wrong with the machine," and within a week it was fixed. And I mean, and the good thing about it, I was able to get a replacement machine while the machine was away being fixed, and to me that convenience just helps keep the whole keeps you on track, because if you don't get that good night's sleep, life turns around.
I think that last comment says a lot about ResMed as well. I've noticed their customer service, working with me and my patients has been terrific. So it's been fantastic working with those guys as well.
Yeah.
Frank, I've got to thank you very much for your time. It's been really insightful for me. I mean, we usually get a 15, half an hour consult just to talk specifically about sleep apnea, but it's been great getting some other background information on how it's affected you and your thoughts on the condition in general. So thanks very much for your time, mate.
And the pleasure's all mine. Thank you.